Quality Improvement Project, Planning and Implementation of a Multidimensional Hand Hygiene Program by Alyssa Williams, Catherine Stuckey, Katie Crow, Laura Ford, Maggie Weiser, Midge Duncan, Tori Button, and Twinkle John. Problem of focus, how to improve hand hygiene compliance in medical facilities to help decrease the rate of hospital-acquired infections. How many nurses know and follow the 5 moments of hand hygiene consistently? Background. A hand hygiene program is needed to improve hand hygiene adherence in accordance with the Joint Commission Patient Safety Goal Number 7. The hope is to reduce the amount of hospital-acquired infections. According to Healthy People 2020, 1 in 25 infections is hospital-acquired, with poor hand hygiene being one of the contributing factors. Goals for improvement. Increase patient awareness and education on the importance of hand hygiene. Improve the rate of hospital staff compliance with hand hygiene. Increase the level of awareness to the cause and the repercussions of failing to comply, reducing the level of staff forgetfulness by using some of the implementations we created. Lean Map, current. New nurses are hired, go through orientation, and complete a skills checkoff. They are either compliant and can continue with patient care, or may be non-compliant with hand hygiene due to factors such as time, lack of knowledge, forgetfulness or distractions, laziness, unpleasant smell, or drying out of hands. Approaches for addressing the problem include teaching clients and their family to speak up, hand washing detector devices such as BioVigil, annual educational videos for everyone, doctors, PCAs, nurses, etc., monitoring staff, hospital-approved lotion dispensers to prevent dry hands, and educational posters around the hospital. Our first approach for addressing the issue is patient education. This includes a video educating patients about the importance of hand hygiene, asking them to speak up if someone fails to perform hand hygiene before giving them care, making it mandatory to watch before they are able to access their TV. This enables patients to be ambassadors for their own care. Our second approach to addressing this issue would be an alert system, which was motion triggered and placed in the doorways of staff bathrooms and patient rooms. When a door is opened, a voice will say, "Remember hand hygiene." This reminder will make it more difficult for each person to forget their hand hygiene.
I'm Maggie, I'm going to be the nurse.
I'm Laura, I'm the PCA.
I'm Catherine, I'm the patient.
And we are Katie and Twinkle, and we're the family members.
Hi, can someone please help me go to the bathroom?
Hi, I'm Laura, I'm the PCA. I'm going to help you to the bathroom. Okay, you let me know if you need anything else,
Okay.
and your nurse will be in just a little bit.
Okay, thank you. Hi, I think there's something wrong with my IV. Could you come check it, please?
Hey Catherine, sorry it took a while. I've been really busy, but here, I'm here to flush your IV. Let me see it. Alright. Do you need anything else?
No. Thank
Okay, I'll be back to check on you.
you. Okay.
Let's watch some TV. I'm bored.
Okay. Looks like we have to watch videos on hand hygiene before we can watch anything else. Hi, I was wondering if someone could help me go to the bathroom, please.
Hi, I'm here to help you to the bathroom.
Stop! Did you use hand sanitizer?
Oh no, thanks for reminding me. All right, are you ready now?
Yes.
call light.
Thank you. What's wrong with my IV? Could you come check on it, please? Hygiene. Remember your hand hygiene.
Hey, Catherine. So you said something's wrong with your IV?
Yeah.
Looks like I'm just gonna try and flush it really quick, okay? Oh, all right. Do you need anything else?
No, that's it.
Okay.
Thank
well,
you.
let me know if you need anything.
All right. Ding. Remember your hand hygiene.
Consequences of poor hand hygiene include nosocomial infections, which are hospital-acquired infections, most commonly E. coli and MRSA. This leads to increased morbidity and mortality, longer hospital stays, and increased health care costs. Why is hand hygiene important? Poor hand hygiene can lead to the transmission of illnesses such as Shigella and rotavirus through the fecal-oral route. Germs from other people's hands can be transferred to objects such as handrails, toys, and trays into another person's hands. Nurses transmitting infections to patients by not washing their hands. Lean methods. Root cause analysis. Systemic process of identifying causes to a problem and figuring out approaches to prevent the cause, which will then correct the problem. Poka-yoke. Purpose is to eliminate mistakes by preventing, correcting, or drawing attention to human error. Gemba. Management by walking around. This idea is that if there is a problem, people must go to where the problem is occurring to fully understand what is happening and to be able to correct it. Lean map. Future. New nurses are hired, go through orientation, complete skills checkoff, and are either compliant and continue with patient care, or may become non-compliant with hand hygiene. If they are forgetful or distracted, there will be posters, hand washing detector devices, and patients are able to speak up about their own care. If they're lazy, there'd be the hand washing detector devices, patients who speak up, and monitoring of staff. If they believe there's an unpleasant smell, there would be hospital-approved lotion dispensers to prevent dry hands and unpleasant smell. If it is time-consuming, there's hand-washing detector devices telling them when to wash their hands again. Patients will be able to speak up about their own care, and there will be monitoring of the staff. For a lack of knowledge, there would be annual education videos and patients speaking up for their own care. We consulted with Megan Livers, RN, BSN, who has med-surg, ICU, and ER experience and is an expert on hand hygiene. She told us that our lean maps fit accurately with what she has seen in the field. The staff are trained at orientation on proper hand hygiene, and compliance is momentary as days and weeks go by. Compliance rates drastically reduce. She informed us that some common barriers that she has noticed affecting hand hygiene compliance include laziness, time consumption, and skin irritation from the constant use of sanitizer. Plans for future progress. Monitoring the documented cases of hospital-acquired infection to see if the rate is decreasing after the implementation of our interventions. Patient education can prove to be useful when conducting a satisfaction survey that confirms both patient and staff compliance of hand hygiene when entering and exiting patient rooms.